Rethinking Fabry, strategies for staying vigilant, keeping your disease in check today for a better tomorrow with Fabry. We spoke with leading doctors and healthcare professionals from different specialties about why you should pay attention to the progressive nature of Fabry and some strategies you can start using right now to help protect yourself from future damage. What does it mean that Fabry is progressive, and why does it matter?
It means that if not treated, the symptoms will appear and they'll get worse over time.
Fabry disease is a deficiency in an enzyme called alpha-galactosidase that breaks down a substance called globotriacylceramide. And this disease has a cumulative effect. So if you imagine that globotriacylceramide, or GB3, that's what builds up. So think about alpha-galactosidase as the trash man. GB3 is the trash. So as the trash builds up, people feel worse and worse, and that takes years to occur. In people with severe Fabry disease, the trash buildup reaches a critical level much earlier. But that doesn't mean for people that are asymptomatic at the age of 40 that now by the age of 70 they won't have symptoms, right?
So the likelihood that this may progress over time is real. And we can catch you when you're asymptomatic. That is much better than waiting until you're symptomatic.
The good news? You can play an active part in managing your disease, regardless of how mild or severe it is right now. Here are some strategies you can start using right away. 1. When you notice any changes, speak up.
Show up. Show up to your doctor's appointments and communicate. That's number 1.
There are some things that can happen with Fabry disease that you would want to let us know right away. So for example, signs of a stroke, so things like slurred speech, sudden vision changes, we want to know about those immediately. Some things you can give us a call and we can decide whether we need to see you sooner, whether there's a treatment or an intervention. So say you haven't had much pain and then you start having burning pain in your feet. That would be a reason to give me a call.
Don't just grin and bear it. I mean, we shouldn't be in the grin and bear it. There are things to do.
So, do you feel chest pain? Do you feel short of breath when you exert yourself? Do you ever feel palpitations or butterflies, your heart kind of jumping around in your chest?
Any neurological changes? Seizure, weakness, headache, inability to do some of the things that you're able to do in the past? Any major changes in your mental status?
Those are all things that we would want to know.
2. Be your own best advocate.
There are a lot of things that patients can do that will help them in management of their Fabry disease. Things like leading a healthy lifestyle in general, making sure that they follow up with their doctors. But there are other things as well. I have some patients who write down or ask for copies of results of testing. And a few of them even come in with, hey, I'm due for my kidney. Would you mind doing that? Testing me for it. And they want me to show them the graph that shows how things are changing over time. I think that's awesome because that allows them to be looking for times when things might need to be adjusted. The patients themselves can't order some of the kinds of studies that they need, but they shouldn't be shy about pushing the doctors to do the right thing.
3. Press your doctors to keep evaluating your treatment plan.
If they're starting to feel worse, well, we need to get some objective data. If it's mid-cycle between their annual imaging, I'd probably get imaging earlier. I'd probably recheck their labs to see if there's some objective piece of information that shows that their disease is progressing. If I have data that matches up with what they're saying, then I will change their medication, either increase the dosage or change the frequency.
By treating each of the symptoms that you have, In addition to treating the Fabry disease, we can also help. Well, if somebody starts to have protein in their urine, we may need to treat them with medicines that decrease the protein loss in their urine, and that will delay the progression of their kidney disease. And there are similar concepts for each of the organ systems.
4. Think about how continuing treatment now might affect the future.
Is there anything that you're looking forward to doing and that you want to be in good shape to be able to do, and hopes and aspirations for things that you still want to accomplish? And if the answer is yes, and you meet the qualifications for treatment of Fabry disease, you probably should stay on treatment. Because if you stop treatment, your body is going to start storing more GL3, and that's going to lead to more damage to your body and potentially make you sicker.
Fabry is a progressive disease, but by taking a proactive approach with these strategies, you can help make a difference in what's possible in your future with Fabry.